Hi, I'm Dr. Rich, teaching you about dentistry and teeth so that you can have a very nice smile. A Willis Bite Gauge is a simple tool that I use to help me make dentures for patients. It was invented by Dr. Francis Willis, and it is a quick, easy way to measure the distance between a person's jaws when they are biting down on their teeth. Dentists call this distance the vertical dimension of occlusion, or VDO for short. The bite gauge consists of two pieces of metal, a long piece with distance in millimeters marked on it, and a short piece which slides over the long piece and has a set screw to lock it into place. To use it, I place the end of the long piece under the patient's nose, then adjust the short piece snug under their chin and lock it into place. I can then record the number and use it whenever I need to reference it. I will use this measurement when I make replacement dentures and immediate dentures. I will use it to adjust the wax on the bite rims and during the wax try-in visit to make sure the jaws are the correct distance apart. I will even use it when I reline a patient's dentures to make sure that the reline material is not too thick. If a patient loses their dentures or has a severely worn down denture, the Willis Bite Gauge will still work. With the gauge, I measure the distance from the parting line of their lips to the middle of their eye. I then use that measurement as the VDO when I make their new denture. My bite gauge that I use was made back in the 1950s or 60s, based on the looks of the box and the instructions. It was made by SS White Company, which is still in existence, but they no longer make bite gauges. You can find similar bite gauges on Amazon for about 12 bucks. I'll leave a link to them down in the description. This tool is not the only way to determine the proper VDO for a set of dentures. There are other methods that dentists use. A simple one that is similar to the Willis Bite Gauge is to just take a wooden tongue depressor and mark the distance from under the nose to the bottom of the chin with a pencil or marker. For patients watching, what method did your dentist use? Let me know in the comments.